The circaid reduction kit leg consists of foot, lower leg, knee, and upper leg. This garment consists of 2 components and a spine. The printed numbers represent the thigh circumference E2, the knee circumference E, and the calf circumference C. The 2 components are connected with a spine. First, mark the calf circumference C at the bottom, the knee circumference E in the middle, and the thigh circumference E2 at the top. Connect the points and cut both components along the plotted line. Align both components precisely without overlapping. Place the spine in the middle and connect the 2 components. Trim off excess material of the spine. Label the garment for the right or left leg accordingly. As soon as the leg has decreased significantly in circumference, trim the garment to the new measurements and remove the excess material. Make sure that there are no wrinkles in the undersleeve. Align the knee component in the knee crease at the height of the medial numbers. Attach the top 2 bands loosely to hold the garment in place. The knee component should overlap with the lower leg garment. Attach the bottom-most band with firm and comfortable tension. Attach the bands alternately from bottom to top so that the garment lays flat and wrinkle-free. Slightly pull the upper band upwards to avoid wrinkles. Hold the top of the garment while attaching the last band. If there are gaps or creases, simply readjust the bands. The bands should be tightened with firm and comfortable tension within the tolerance level of the patient. For an effective therapy, you or your patient should readjust the compression throughout the day. Roll back the bands to keep the hook fasteners lint-free.